And welcome everyone. I am thrilled to dive into today's topic, the health belief model and phishing. Some of you might have heard about CyberGreen and Adam Shostak's study and presentation on the cyber belief model, which adapts the health belief model to cybersecurity context, to explain how people perceive cybersecurity risks and what motivates them to take protective actions, such as to avoid phishing attack. So a concept that directly ties into our discussion today. I'm equally excited to introduce our presenter today, Dr. Andrew Kalafut. Dr. Kalafut founded the Institute for Cybersecurity Education and Research at Grand Valley State University in 2023, where he currently serves as the director. And in addition to this role, he's an associate professor in GVSU's School of Computing, specializing in teaching cybersecurity. We are especially delighted to welcome Andrew to the Ostrom workshop because he earned his PhD from Indiana University. So, with all that introduction, let's welcome Dr. Andrew Kalafut.
Thank you. Okay, let me see if I can share my screen.
Yeah, it's starting.
That's maybe working. Okay, great. Okay, so this is health belief model and phishing. This is based on a publication that we put out just a few months ago, just very recently. So this was done by a group of us here at the College of Computing at Grand Valley. And although the titles you see on every single one of these people are the same, there's kind of some relevant differences here. Mainly that I'm the only one on this team who comes from a cybersecurity background. So my background is in computer science and then moving into cybersecurity. Greg and Gia, they come from an information systems background and teach primarily in our information systems program. What that essentially means for this presentation is if you ask me in-depth questions about the statistical analysis, I probably can't answer them very well. Because I am not the one who has the familiarity with the IS style research methods used here. My approach is more in terms of bringing expertise on the cybersecurity content to the study. Okay, so I think everyone here today knows about phishing, right? And I imagine that probably many of us share a similar outlook on it, which is that I fundamentally believe that we can't take these security problems that are inherently people problems and solve them through a technical measure. All right, we need to solve these people problems by, well, addressing the human in the picture. And of course, people have tried to do this for a long time. We have human-focused countermeasures. We have training programs, things like that. But it's also pretty well known from the research that cybersecurity training programs are effective for about 6 months. You train someone, 6 months later, their behavior is essentially back to pre-training levels. This isn't very effective. We don't want to keep having to train people every 6 months. And even 6 months is not the right time for them to be thinking of. 6 months, they're back to pre-training levels. Where are they at in the 3 months? Probably not where you want them to be. Okay, so in order to build better human-focused countermeasures, we need to understand what's driving how the human behaves, of course. Okay, so then that's our research question here is what is driving people to take the necessary preventive actions to protect themselves from the risk associated with phishing attacks? And we're approaching this, of course, using the health belief model. And now, I know that those of you on the call are familiar with the health belief model, but this is coming from healthcare, right? Designed to explain preventive health behaviors undertaken by healthy people to prevent disease or detect it in early stages. This might be a clue that it might not be exactly the right model for cybersecurity, in that it approaches healthy people. It doesn't approach people who are already sick. And I would claim that many of us are starting from already having cybersecurity problems. But still, I don't have necessarily a better model to approach it with. So we can borrow this and say these are still preventive security behaviors, right? Just like we had preventive health behaviors. And this model's been used to study cybersecurity problems, including phishing. My own research group, Greg and Gia, before I joined their group, did a previous study, smaller scale, on phishing with the model. Greg, Gia, and I did a study a few years back on location-based services. So the ability of apps to track you and enabling or disabling those permissions. And we applied the health belief model to people's behaviors for that. So it's been used for cybersecurity in the past, certainly. So we take the health belief model, we take just the kind of standard constructs in the health belief model, and we add a few interaction terms that we're looking at. All right, experience as a moderator, severity as a moderator, and then that three-way interaction. All right, on this kind of idea that maybe if people perceive the threats to be more severe, they're more likely to pay attention to training. They're more likely to understand that there's some benefit to preventing something that's more severe. All right, and similar for experience, that the more experienced they are, the more they will realize the benefits, the more they will understand their vulnerability. So we would expect there to be interactions in these terms. Okay, so like I said, the health belief model has been applied to cybersecurity before, even to phishing before. So what's the new contribution here? And to me, the new contribution that we're offering is two things. All right. One is that we are bringing a somewhat more diverse population than we've seen in previous studies. As I'm sure you know, many academic studies like to use a population of convenience, right? And that population of convenience, typically students, often even confined to students in a single class. And in fact, the previous phishing study that we did or that Greg and Gia did before this one a few years back, was confined to students in an introductory computing class. And so we've still used the population of convenience, our students, our faculty, our staff at the university, but we've used kind of a larger one than we tend to see in these types of studies. And then because we used not just students, but our entire university population, the second contribution here is this ability to examine the difference between subgroups in the population and see if, well, students and university employees have different factors that are affecting their engagement in these preventive email security behaviors. All right, so that's what I would define as our contributions. All right, and I think since most of you are familiar with health belief model, I won't dwell on the definition of all of these constructs. We're pretty much using the standard definitions here. Okay, so then diving into what we did a survey, 32 questions on a 5-point Likert scale. Plus we asked a few demographic questions as well. We had our Office of Institutional Analysis here help us with their historical data on what they typically get in survey responses to know how many we should send out to get an acceptable level of responses. And then they sent out this survey for us. So this was going to a random sample of students and a random sample of faculty and staff sent by our university's Office of Institutional Analysis. All right, we ended up with 418 usable responses, usable as in they didn't stop halfway through and they didn't answer the question that asks you whether you want to participate by declining to participate. 101 students, 317 faculty and staff. As you can see in the table on the slide up here, we do have a rather significant gender bias in the data. 63% of our respondents were female. I don't know the source of that bias. That bias is not present in who we are sending the survey out to. It is very clearly present in who is choosing to respond. So I'm acknowledging that bias. We're not going to do anything about that bias, but acknowledging that it's there. Okay. So we sent this out. We got our 418 responses. We did two-step analysis here. So first we did exploratory factor analysis to validate that our questions loaded on to the latent variable constructs as we would expect. And then once we have those constructs, we do regression analysis to check if those constructs actually appear to be having a significant effect on the behavior. The entire analysis was performed on the entire data set and also on the student and the faculty groups independently. And we get different results from each of those three populations. Okay, so when we do the exploratory factor analysis on our whole data set. As expected, we're able to get 8 factors. All of the factor loadings meet acceptable thresholds. And pretty much every question we asked loaded onto the factor that we expected it to, with the exception of one question, which was this EXP1 question: how often do you receive unsafe emails in your inboxes? This somehow didn't load with the rest of our experience questions. There is a little bit of a difference between this one and the rest of our experience questions, in that the other 3 asked specifically about impact and effect that you had, whereas this one is more of a judgment of if you're receiving unsafe things or not. So it in that perspective makes sense that it would load on with the vulnerability questions. If you think you're receiving a lot of unsafe emails, then you probably think that you're vulnerable to them, that there's a good chance that you will receive other unsafe emails. So in retrospect, what happened here makes sense.
Can I jump in with a question,
Yeah,
or should we hold it
absolutely.
to the end? Yeah, so what was the expected place that was going to load?
With those other experience questions that were on this that are on the slide.
Okay, because I would expect that the receive unsafe emails would contribute to perceived threat. Right, that would just be my naive expectation.
Yeah, and like I said, in retrospect, it kind of makes sense that it aligns to that. It's not how we were thinking of the question, but in retrospect, I agree that it does make sense that it ended up doing that. Absolutely.
Okay, I see what you're saying now. I thank you.
Mhm. When we look at students and employees separately, we end up with something that's just slightly different. We end up with a few items, mostly in our cues to action questions, that essentially didn't load. They had low factor loadings, no matter what we did here. So looking at these in a little bit more detail, here are these questions. The ones highlighted in blue here, 1, 2, and 5, are the cue to action questions that didn't load for students. Did load for faculty and staff. The other 2 highlighted in purple, questions 3 and 4, did not load for faculty and staff, did for students. So the exact opposite for all of our cues to action. Once again, we can kind of see a difference here between these 2. Questions 1, 2, and 5 relate to being told about something. If I received an email, if I saw a news report, if someone told me of a recent experience.
Sorry, I don't understand the word loading that you're using in this context.
Okay, yeah, absolutely. So when we do the exploratory factor analysis, what we're essentially trying to do is take our survey questions and do a statistical analysis that shows their relationship to some kind of hidden latent variable. So if we have a low loading score, or in shorthand, it didn't load, what that means is that the question didn't really, from the statistical analysis, correlate to any of the latent variables that were observed. Right, which then comes to mean that the question essentially seems to have little relationship or impact on anything else. Does that make sense?
So you're not referring to how the student or the faculty answered the question. You're referring to how the question was answered and its relationship to their other answers.
Yes, so we look at the answers to all of the questions. We perform the exploratory factor analysis process, which then shows us which of those questions are in some sense related to each other, so contributing to the same latent variable. Yes.
Thanks.
Okay, so kind of the takeaway here is that certain types of cues to action are appearing to have little impact to students. Mainly these cues to action where they're being told about things. All right, being told that they have a risk. A different type of cue to action, I was victimized, my computer is acting strangely, appeared to have little impact to the faculty and to the employees. Any explanation I can give as to why this is purely speculative, but we can, kind of imagine that through experience, faculty and staff perhaps have other worries when they get identity theft of what might be going on and not attribute it to something like phishing. We can consider that students, maybe this age group, doesn't trust being told what they're told what to do, maybe more trusts experience. That's pure speculation, but it's how I can explain kind of these categories of questions not loading. After we do the regressions, we do this, after we do the factor analysis, I should say, we went ahead and did the regression analysis as described. Okay, I've highlighted in green here what appeared to be the significant factors at various p-values. And we can get some quick observations out of this. Different things appear to be significant for the different groups, students, employees, or looking at things as a whole. Why something that was significant for the whole didn't end up significant for students or employees is a little bit odd, but is most likely due to the smaller sample size of either part. Okay, but the key observations that we can see here is that two of our factors, two of our constructs don't appear to in any one of these groups have a significant effect on the regression. Okay, perceived severity does not appear to be a significant determinant of email security behavior. This is consistent with most, but not all, of the other research we're aware of in applying health belief model to phishing. Which is not the same as to say all the research applying health belief model to security. Research applying health belief model to other security problems does tend to find perceived severity as being important. Cues to action was not found to be significant. This is consistent with every work we're aware of that applies health belief model to phishing, with the exception of Greg and Gia, my research group's previous paper from that smaller previous student group. Self-efficacy was both the strongest factor in terms of p-value in our analysis, and the only one that appeared as significant in all three, looking at the whole, looking at the students, looking at the faculty. It is also the only factor that, if you look at all the previous research we're aware of in applying health belief model to phishing, that every single study finds to be significant. The only one. Okay, so in that sense, the results that we're getting are consistent with prior work. That's good. We want to see that. Okay. We've got a couple questions here in the chat. Cues to action don't matter. Yeah, I'm not happy about that either, but it's what the results tend to show. How is self-efficacy defined here? Self-efficacy is essentially a person's belief that they are capable of taking the correct actions. Okay, so someone's belief that they're capable of taking actions that will prevent them from being victimized by phishing seems to correlate pretty well. Gene Camp, how did you design and evaluate the cues to action before the experiment? Our questions were mainly based on those of previous research. We did do some modification for clarity. We did send out a pilot survey to a small population, got feedback on what questions were unclear, and make some modifications. That being said, I make no claim here that my cues to action are comprehensive, and in fact, I'm going to hit on that point a little bit later. Diving into perhaps the more interesting part of the results, these moderating factors, and looking at the students and the faculty, or the students and the employees, as individual groups. You know, when we look at the students, right, experience and self-efficacy, we both found to be significant. When we look at those interaction effects, we find that higher levels of experience reduce the positive effect of self-efficacy. we look at severity's effect on barriers, we find that when the severity is low, or the perceived severity is low, we get very unintuitive results here. The higher barriers seem to actually improve the behaviors we're seeing when severity is low. We don't see that when severity is high. When severity is high, we see barriers to have the influence that we expect, that a higher barrier leads to worse self-reported behaviors. It's difficult to say whether this is meaningful, given that severity and barriers did not show up as significant factors in our regression for this population. But this interaction term does show up as a significant factor in our regression, the relationship between these. Moving on to employees, we see that more experience reduces the positive effect of perceived benefits. Just to say that when people self-report that they have experience, there is almost no positive effect of perceived benefits. Whereas we do have that effect for people who don't report being experienced. And we have another one of these unintuitive results here. When we look at this relationship between severity and cues to action. When perceived severity is high, the cues to action actually seem to reduce these positive preventative email security behaviors. It's an observation from the study. Once again, it's not something that I have a good, easy explanation for. Stress reaction? I don't know. Adam.
So, yeah, so this reminds me a little bit of Angelasasi's work on compliance budgets. And maybe what we see happening is that the cues to action are draining the compliance budget. And so people run out of energy.
Yeah, that's an interesting thought. I don't know off the top of my head how you would look into that, but it definitely seems worthwhile.
I might try if you're planning to do more work in this, I think an interview study where you throw out some hypotheses and get people's verbal reactions might tell us whether or not it's worth trying to dig into in a quantitative way.
Yeah, sure. And that is one kind of absolute admitted downside to our approach to this, is that we jumped right into a survey without this step of an interview to kind of get some free form answers for people to refine, to base questions on that sort of thing. That is a thing that we do plan on correcting or doing differently in the future. Yeah. So to move forward to kind of a little bit of conclusions and thoughts on where we need to go to get more directly applicable results, right? So conclusions. one thing that we absolutely did find is that the factors that are influencing email security behavior differ between our two populations. Right? So we have, you know, a lot of studies in the literature that take their set of questions and apply it to one population, and then someone else does a study with a different set of questions, and they get different results on a different population. But is that due to the population or the different questions? Now we have the same questions to essentially two different populations, and we are seeing significant differences. So as academics, this probably tells us that we need to be more careful about the populations that we are studying and surveying, and that the bulk of the research here is that we see in this field is using students might not be giving us generalizable results. I don't claim that I'm giving us generalizable results. I'm giving us two sets. But do faculty and university employees behave the same as people working in various industries? To a large extent, I doubt that. Right? So I'm not claiming they generalize. In fact, I'm claiming that we need to be very careful about generalization. For industry, perhaps the takeaway from that is buying an off-the-shelf training designed for one population perhaps may not work so well on others. We did see self-efficacy, perceived vulnerability, benefits, barriers, and prior experience all having a impact. This is good. What didn't we see, though, is the cues to action. All right, so where I really want to go with this next is diving much deeper into these cues to action. For one, even when you look at research using the health belief model, various papers design their cues to action questions in very different ways. And we took all of ours in this format. If I saw X, I would be more concerned about doing this undesirable thing. And we see this format of cues to action in the literature, but we also see cues to action questions in the literature phrased just saying, I recently saw X. And that's it. So have they experienced this cue within a certain amount of time prior to taking the survey? I don't know if this leads to different results. I don't know that it doesn't. Right? But we do need to investigate the possibility that the way we're asking it is leading to misleading results. Right? And make sure that that's not the case. But we also need to be concerned about the fact that much of what we do, security training and awareness activities, are all premised on this idea that a cue to action, sending something in a newsletter is meaningful. Right?
So,
and yes, go ahead.
no, please go ahead. Well, I wanted to build a little bit on cues to action. So the FEMA Preparedness in America surveys
Mhm.
have always tried to parse out this difference in cues to action. Because it is very easy for an individual to say, yes, it's important to be prepared for a disaster, but which of those cues, which of those statements, it's be prepared for a disaster and then what? And then so it usually goes along the phrase like I should be prepared for a disaster because you are responsible for your family, that has been found to not link with a preparedness activity
Hmm.
where someone actually takes action to reduce their risk from a disaster event. And so it's actively suggested that we would limit that messaging. Yeah, so like, and then other ones is like, you should be prepared for a disaster because it is affordable. Limit that. Like, don't talk about
Right.
that. And it's really interesting because you're seeing kind of the same perspective where perhaps your cue to action may be considered simple in the terms of like preparedness.
Sure,
Um,
yes.
because you're just saying, are you aware of this? Like,
Yes.
did you
So
recently see consequences of this act?
right. So I think we need to be comprehensive in looking at different types of cues to action. Certainly things like a report in a newsletter. I don't know about you, I have newsletter fatigue. I get 4 newsletters from my university a week from different departments. I'm not going to take it all in and act on it, right? So we need to look at different cues to action, and absolutely the point that was just made at looking at what these cues are actually prompting them to do. And if cues to different types of actions get us different results, that would be interesting and meaningful. The
Uh,
other the other downfall that I don't really know a great way to fix is, of course, this whole thing is self-reported, right? So
do-
someone can claim that static cue doesn't affect them. Does it really not subconsciously affect them? I don't have great ideas for how to study that.
yeah, to kind of build on that cue for action, for instance, my organization regularly sends out training phishing emails. That's
Mhm.
a cue to action. Like that is forcing me to interact with a training phishing email. And that's
Okay.
cueing me into a behavior that is expected of me. Um,
Yes.
I so that's maybe it's our cue to action concept here is too simple and there's like a wider breadth of cues to action. I see that your awareness of like sending in the newsletter, I can completely agree
Mhm.
um, that the cue to action from a newsletter is essentially you're trying to build intrinsic motivation
Sure.
using an external aware, like, hey, be aware.
Mhm.
That doesn't really convince people to do anything.
Yeah.
Like standing on the corner saying you should be prepared for a disaster event does not cue a
Yes.
preparedness
Yes.
action, does not relate to that.
Yes.
Um, and so like it's really interesting that you're kind of measuring all cues to action as this.
Yeah, I would be happy to talk with you about this further because this is an area that I'm really interested in exploring. And as I mentioned earlier, this matches the results that everyone else is getting as well. But then to some extent, almost all of these studies are patterning their questions off of each other to an extent, so might suffer from the same flaws, right? Or similar ones.
Yeah, and
Yeah,
there might be an interdisciplinary event that you have to do here where you're like pulling questions from outside from a related field, like
yeah,
the disaster preparedness field. This might be where you
yes,
find those cues to action, or even the like, I mean, you're pulling from public health, the public health
yeah,
space. Like, how are they determining what is a cue for action?
absolutely. The other future work in mind, of course, is the results show that we need better representative populations. Adam, question?
I wanted to go back to what Blake was saying about and also what you were saying, and I don't think of a phishing email as a cue to action as much as an opportunity to address the concern that you raised about where we're measuring what people think they do. And one of the nice things about being at a university is that you have a stable staff and an unstable population of students who you're sending phishing tests to on a regular
Sure.
basis. And maybe there's a way to deal with the privacy concerns and the anonymity concerns that you might have in the survey and actually observe behavior when people are exposed to test phishing emails to see what their beliefs do when not do to see how the outcomes of phishing tests relate to their beliefs.
Yeah, I think a phishing test is a few different things. One, it is an opportunity to study, like you mentioned. It is also an opportunity to improve self-efficacy. If you can give people the confidence that they are able to recognize those emails, you improve self-efficacy. And to some extent, especially if you are following up on the people who failed the test to say you need to improve, that is in some sense a cue to action.
Yeah, and I think this sort of ties to Blake's point, standing on the corner with a sign that says you need to improve.
Sure.
Um, it
Yes.
doesn't
Yes.
necessarily lead them to the right improvement for the next thing they're going to encounter.
Absolutely agree.
Um,
Yes.
anyway, just wanted to share that
Yes.
thought. You were getting into some more future
Yeah.
work, I think, or some more conclusion. Yeah.
Just that we, of course, the study clearly tells us we need to look at wider populations. We certainly don't know the source of the difference between the faculty and the students. Is it experience? Is it age? Is it something else? So we would want to do something more designed towards finding what the underlying cause is there. And
So,
that pretty much takes me through what I have.
Andrew, thank you very much for this. This is a fantastic work that you've gone through. I really wanted to kind of dig into that population. What I think might also be occurring here is we might be devaluing experience with email software. Students don't have, I was a student just recently, students don't necessarily have this high expectation of value accrued through email.
Right.
Um, they're not required to respond to their email. Maybe in some rare instances, but you and I, working in like modern workspaces, we have to respond to emails daily. We have to clear
Yes.
our inboxes. We have to answer emails from our boss. The students don't have to do that. They have to show up to class. They have this like a
Sure.
built-in meeting, and they rarely have to look at their email, if ever. Um, and most, I'm sure you're probably a professor, most probably don't even respond to your email requests.
Yeah, to some extent, I would
We
expect.
respond to as many emails as we possibly can.
Yeah, to some extent, I would expect something like that to be taken care of through like the severity construct, that they wouldn't see a email compromise to be as severe, but it is very possible that that construct isn't fully capturing these types of things. I also kind of think about somewhat of a maturity or general experience type of thing affecting this. And there was one study, I can't remember whose it was, that added kind of a general security orientation variable into the health belief model. which we certainly didn't do here. But I wonder if that type of thing that just life experience leads them to have, leads our staff and our faculty to have a better general security orientation, which then affects this problem in specific. Right, but that's something that we would have to explore into a more detailed follow-up.
Sorry to keep jumping in. I'm just really taken by the work. And one of the things that you said a couple of times was that this reflects other phishing work that's been done over the years. And it occurs to me that a lot of people half reinvented the health belief model as they were trying to figure out what it was they were looking at. And I'm wondering if there's a place that this work can accelerate other security work. For example, where I am reading a lot of stuff about deep fake oriented phishing or voice cloning oriented phishing. And I'm wondering if that would be a future workplace where you could show what the differences are between that technical approach to phishing and other approaches to phishing, and use the health belief model to accelerate the research that's happening in a useful way and do some groundbreaking stuff with it.
Yeah, that's interesting. I haven't thought about that question at all, so can't give any insight on that, but I like the idea on its surface.
That's what this workshop is for, is to spark new stuff as well as to learn about your work, of course.
Sure. Yes. Blake.
Yeah, so this is a complete different tangent gonna dive down is, so how do you, health injury, health illness is usually experienced very obviously to the individual experiencing the illness. You know when you're sick, right? You generally know when you feel bad. Cyber phishing or loss of credentials is usually not internalized to the individual. You don't feel like you've been phished, right? It's not obvious to the individual from a physical standpoint that you've been harmed in a cyber way. So have y'all thought about that concept of like this external versus internal health cyber belief model where it's illness is experienced internally, but cybersecurity events seem to be experienced externally? Yes, they affect you, but it's like very remote physically.
So the main connection, of course, comes from them both being preventive, but certainly you are preventing two very different things. I would say that the things that we are preventing in terms of phishing ultimately comes down to things like identity theft, which is a thing that is very quickly felt by the individual. And these are both looking at preventive behaviors. As I mentioned kind of up front, the health belief model also isn't trying to address what people's behaviors are when they're already sick. So I would say that, yes, the effects are different once you're affected, but since we're looking at behaviors before the person is affected, we wouldn't expect to see a large difference. That's kind of my thought off the top of my head.
Oh no, I think you're
Yeah.
getting at a really important point. Prevention is key, right? You want to prevent illness. This cyber belief model is also using that public health belief model of prevention. But it's kind of interesting, like sometimes in a public health sense, like we have self-healing systems, like they tend towards health or they tend towards a baseline homeostasis, I would argue that especially in most cyber situations, they tend to break. They tend towards failure. Like the default is it broke or is non-living and doesn't
Okay,
tend
yes,
towards this
yes.
homeostatic situation. And so like it's really interesting to think about like how can we apply that public health model into the cyber context in which it just tends towards being just broken.
Sure.
Because it's not
Yeah.
self-healing. Like you can't just self-heal from a uh phishing attack. You're not
Right. Yeah,
the natural state of a phishing attack is it's dead. You just
Yeah.
died as far as it's
Identity theft doesn't resolve on its own. Yes.
yeah.
Yeah.
Well, this was really the really wonderful presentation on the month of cybersecurity awareness. Indeed. So, Andrew, thank you very much. This was fascinating, and we should definitely continue. And welcome to the group.
Yes.
Thank you. We have a Slack channel to continue this conversation, and we should just definitely do that. I'll send you the invite to the group.
Absolutely.
Yes, thank you. This is a monthly conversation. November and December is going to be a little difficult because we're getting into the holiday season. So we might going to change the change from the regular scheduling, but we're going to let you know and then maybe check on the Slack channel. So with that, thank you very much, everyone. This was amazing. Thank you, Andrew.
Yes, thank you for inviting me.
Thanks, everyone.
I
Take
will
care.
definitely reference that work in the future.